And you have multiples of training choices. So what is the best thing to choose? And I'm going to talk about 3 different options that you have for training. So you can do it yourself. You can use the office manager or somebody on your staff who has a great understanding of HIPAA. At that point, that can be very cost effective. It's really easy to incorporate new staff because you have a staff member doing the training, and they have familiarity with the policies and procedures. I would recommend, if you go that route, to have somebody who is either the security officer or the privacy officer, or if you're a small practice, it is the privacy. It could be the same person being both privacy and security officer. Some of the weaknesses that you might come up against is, does your staff member really know the ins and outs of HIPAA? Are they really an expert on it? Did they go see a weekend seminar on this, or have they actually been studying up, following what's going on with the law? Things have been changing. You've seen some changes, even and seen some updates, and I think we're going to see a lot more updates in the next probably 6 months with the new audits coming down. That we're going to see more clarifications that are going to be happening. You have to keep those records on site. That can be, we want to make sure that if whoever's doing the training is very well organized, making sure they're keeping those training records so they know who's been trained and when they were last trained. And it's difficult to keep up. Sometimes it is difficult to get scheduling together with people coming on, especially with really busy practices. You're limited in the amount of time that you can grab, nurses and front desk staff and get everybody together. And as we said, ongoing training development can be really difficult, and keeping on top of that. So your next option is bringing somebody in. A lot of times that could be a lawyer, that could be a HIPAA expert that you could bring in for a half day or a day. And the nice thing about that is you have an expert who's well versed on what's going on with the law, knows the ins and the outs. You have increased staff engagement because there's a person in there. You may have been saying for weeks, months, years, items that you need your staff to be careful about. They may tune you out. It's nice to have somebody come in who is outside resource and say, all right, this is what we need to do. They say it maybe in a little bit different way, and that can really strengthen that training. Some of the weaknesses with that is how do you incorporate new staff? If you have a lot of attrition, a lot of turnover in your practice, it can be difficult to get people up to speed and make sure that you get somebody into training, because you want to get people trained before they start dealing directly with patients, because they need to understand what their responsibilities are. This is a very, HIPAA's a very important to your practice. And finding time to train everybody together, and it can be very expensive. Half a day with a lawyer with prep time starts at about $2,600. So you have to think it's $2,600 and up. It could be somewhere the $5,000 range, and that's just one time. So depending on the size of your staff, is that really a cost-effective use of your resources? So that's something to think about also. And that's also, you would be spending that money and wouldn't necessarily have depending on if you can work out a deal about getting a plan with that also. That can be a very expensive way to go about it. And then there's online training. That is very cost effective. It's easy to get staff incorporated. You can normally either buy a license or get a license activated depending on what your online training provider does, how they work. Some, we give you groups of licenses. Some do it one-offs. It just depends on the company that you work with. It's really easy to get as I said, new staff can get in really quickly, and staff can do training at their convenience. Usually what you do is set a 2-week, 3-week time limit. You say, we need you trained by this point. Either they bring you a certificate, or with our training you can actually look online and see that your entire staff has been trained. So it's important that you keep on top of that and you monitor that. But yeah, the online training can be good for that. Now, it's important to make sure that those online training that you're using is actually up to date. Sometimes people put those up. We've seen some that aren't up to date, or might use old language as it comes up. And you still do have to train your staff on specifics of your plan. And that would be things like what your password lengths are, complexity of passwords, how they're supposed to text with people. Texting can be really complicated. We're going to talk about that with electronic devices in the next webinar. how you're emailing, what email encryption programs you're supposed to be using, what's an appropriate communication method with patients. So those are important things to think about. This can be really cost effective. If you get a whole plan and training lumped together, I know for smaller practices, we start at $75 a month, and that includes training license up to 5 and compliance documents. So that's a really nice plan that you can get into. It's very cost effective. And I know there are a lot of other providers out there. One of the things that I would warn you about as you get into some of the online training is a lot of the providers that we look at go the death by PowerPoint, where they read you the PowerPoint, and those are difficult sometimes for staff to follow along with. So I would definitely audit your training beforehand. Most, if not all, providers will let you have one license and go through and take the training and see how that works for you. See if you stay engaged, because the last thing you want is a staff member going through something and falling asleep and not retaining that information.